We'll get started. I'm not sure if anybody else will be joining us and venturing out on today's weather issue. So, all right, my name is Dr. Eric. You're here for the ankle and foot workshop, how to relieve pain and improve your function while minimizing injections, drugs, and surgeries. Does that sound familiar?
Yep.
That's why you're here. Awesome. So how this works is a couple of things. I'll do an introduction of myself and the clinic, help gain some perspective as to who we are and what we do here. I want to hear about your situation so that as I present some information that I'm sure to include something that's useful for you. And then we'll have an opportunity to find out a little bit more about ankle and foot problems, what sort of things contribute to them, and more importantly, what can be done for them. And then we'll have an opportunity to see what an assessment of someone's foot and ankle might look like. One of the favorite parts of it is called a 5-minute miracle. And then we'll let you know what steps are available for you to get help for your situation. Fair enough?
Mm-hmm.
Okay, a couple house cleaning issues. Across the hall, through 2 doors and to the right is a restroom. And then there's also a restroom down the hall here, 2 doors to the right as well. So if you need any help, let me know. If you can't hear me, let me know.
Mm-hmm.
Sometimes my voice gets a little bit softer. So there we go. We'll get started. I love this little clicker. We'll advance some slides. So how to relieve foot pain naturally without unnecessary medications, injections, or surgeries. And we help people achieve greater mobility and strength for their active life without medications, drugs, or surgery, even when nothing else has worked. That's our mission statement. I've been in clinical practice for over 30 years, approaching 32 years. I've had the privilege of studying as a fellow in physical therapy, and that's allowed me to learn some of the best clinical practices for pain relief from head to toe, and also be able to understand how that's supported by evidence and research. And been around for a while, so I've helped a few people. We have another few providers. Dr. Rebecca has been here for a little over 1.5 years. She's got over 10 years of experience. She's a great therapist. She's specially trained in what's called functional applied movement science. And she was voted the Physical Therapist of the Year in 2019 for Wisconsin. And it's easy to see why. Patients get great results with her. She's got a passion for all things feet and spine and lower extremity. And we have Dr. Jessica is a recent graduate of Marquette University as a doctor of physical therapy. She's specially trained in vestibular and balance issues. She's also certified in dry needling as well. And she's doing great work with us here. Jean is a physical therapist assistant. She is specially trained in pain relief and sports recovery massage. She's a certified spine specialist, certified upper extremity and lower extremity specialist as well. So, ankle and foot issues are really near and dear to my heart because as a child I had very problematic ankle and feet to the point when I was a young boy. My parents brought me to a orthopedic specialist at the time, and he was really intrigued by how, if you will, malformed my ankle and foot was. And he did a little case write-up on me, and he was more than happy to do a surgical procedure where he would have fused the bones in my ankle and foot. My stepfather never completed high school, and my mother never went beyond high school, but they both had enough horse sense to know that's probably not the best approach. So that's where I started. So it's what brought me to the profession, lifelong interest in learning how to improve health and functional performance. And so ankle and feet issues are really central to me. I'm happy to report that I function very well right now. I'm more than excited because this weekend I'm going up north, for instance, and there's supposed to be lots of snow up there, and I'm going to be sure to get out on some cross-country ski trails. And I'm able to, at this time, even though I just turned 55, I'm able to run and do a number of things. Not very far. Don't get any ideas.
I need a new running partner for our team.
Maybe me
the
to
other doctor backed out. So.
Maybe me to the church. I mean, a little more than that.
Would be
Yeah,
helpful.
We'll have to talk. But, I feel blessed because I get a chance over an extended period of time to really learn what can be done naturally. So I feel blessed. So I'm more than excited to talk about this sort of stuff. So why was the practice started to begin with? Well, first of all, I had no intentions of starting private practice. I grew up in a restaurant tavern, and I saw the challenges of running a small business, and I didn't really want any part of that. I thought, I'll just go to work, but take care of things. But what became really clear to me was, as time went on, there was really impressive research results that we were seeing in terms of what people can do for non-surgical care, and yet standard medical care was overemphasized on medications, drugs, and surgeries. We were coming off the opioid epidemic, which was a complete disaster, and my head wanted to explode because our children grew up in this community. I've been here 30 years, and my family, friends, and neighbors weren't being offered all their best options. So I decided, well, I'm probably not going to be able to have frank conversations about all the available options in all the settings that would likely employ me. So I said, well, I need to start a practice. We're in our 5th year, and we've been doing educational workshops like this since we opened. This month, I think we've done 5 so far-ish, and we do at least two a month. Yeah, about 5, I think.
And it's been quite a few.
Yeah, it's been quite a few. So this is what we do. We like to educate folks. So that's central to why we started. Like, it's an attempt to help people make better decisions about their healthcare, right? You can't make a great decision about your healthcare if you don't know all your options, right? I mean, that's what starts it. And great decisions in healthcare involve usually 3 things. It's called evidence-based practice. Any nurses here? Social workers, so you understand that concept. So basically, the patient's at the center. What is their perspective? What is their understanding? And then you have, what's the experience of the practitioner and perspective? And then is there some research, that third aspect, is there some research that supports that? When you have a common understanding and the patient's empowered, you usually have a really good outcome. But if you don't know all your options, you can't make the best decision. So next month, we're presenting likely in 2 places. We're going to do how to become a really good healthcare consumer. That'll be at the Senior Center, and we're going to also take that to some other locations as well. So we want people to make really good healthcare decisions. If it involves us and we're part of that, great. If not, that's okay too. So we obviously are biased towards non-medication, non-drug issues, and we've got great folks that work with us too. We got to get a picture.
Yeah.
Tomorrow might be a picture day. Get everybody in. Maybe call Courtney in.
Courtney and Lori.
Lori, yeah. So Robin, you've met Robin here, and Kelly's in the background there, and then Megan you saw here. That's everybody so far, right?
I believe so.
All right, great. So what really drives me nuts is hearing that people are told things like, "What do you expect at your age?"
Ageism.
Right? Amazing. You just have to live with it, or just tell them you don't know what to do for them. Just be honest. So anyway, if you wouldn't mind, I'm going to ask you to share a couple things. If you would, your name and what worry and concern you have that brought you to the presentation. Great. All right. So big mistakes that people with ankle and foot pain make is they do nothing. That doesn't include the present company because you're here getting education. If you let things go too long, it can become a little more challenging to treat, but there's certainly a significant amount of benefit people can get regardless of how long they've been bothered. Mistake that people can make is to just end their treatment with just masking it with lotions, potions, braces, creams, gels, that sort of thing, temporary things. I think most people are aware that, like the NSAIDs, over-the-counter non-steroidal anti-inflammatories, do carry some side effect risks. Anybody care to tell me?
Liver damage.
Liver damage, one of them.
Bleeding, stomach bleeding, ulcers, or you just get stomach bleeding.
Right. Cardiac stress, kidney stress, for sure. Opioids. Are opioids safe and effective for long-term pain? No. Part of that is, while we're trying to mask it with something, we're not getting comprehensive attention to it. right? We're gonna talk about what that looks like from our perspective here. Single solutions, discussion was an injection, right? Injection might seem like a reasonable consideration. There are side effects of injections that aren't commonly discussed at the time. If one decides to go ahead with an injection, that's an ideal time within a short period of time there to start to look at some of the other aspects that might have been contributing to that pain to minimize the chance of that coming back.
He was telling me, like, you can do injections about every 3 months or something. And they just do small ones. They do it with a radiologist to get into the right spots.
But doesn't that degrade the density of the bone over time?
Yes.
Yeah, it's probably cortisone in that, yeah.
Yeah, there's you know, it's interesting that there's actually an international proceedings of arthritis experts that I think it was last week just came out and said that even over the counter non-steroidal anti-inflammatories degrade tissues. Like even though they can relieve pain, they degrade tissues. And certainly cortisone can thin out cartilage tissue. It can also degrade the underlying bone tissue. So that's what the research says, right? I mean, that's one of the reasons why it can only be done periodically. That's one of the reasons why the result of the next injection is usually not as favorable as the first injection.
I know I had a heel spur at one point, or plantar fasciitis, and the doctor injected it with cortisone. I've never had a problem since. It was one injection, and
Yeah.
Lovely, yeah. I mean, it can in a big way tamper down inflammation and irritation, right? For sure. So,
I mean, I feel like I've been fortunate because I've had no problems.
Good.
I had 9 injections before this knee was replaced.
I just know that the cortisone injection into my heel hurt good. So, I wanted to tear the arms off the chair and throw them at him.
Oh,
can you put some topical anesthetic on there? Sure. So, so we want to get people back to doing their favorite activities and necessary activities. All right. We can breeze through this. We have somebody who needs to be out at 7. Okay. So we're going to talk about common causes of ankle and foot pain. We're going to run through that now. Arthritis is one. Tendonitis and tendinosis. We'll talk about the difference between the two. Flat-footedness. Heel spurs. Plantar fascia pain. Neuropathy. Ankle and foot joint stiffness. This is a really common and overlooked.
Doesn't that kind of go with arthritis though? I mean,
Yes and no. The ankle and foot stiffness will come with different forms of ankle pain. That can be relieved very quickly without changing the underlying arthritis, and people function a lot better once that stiffness is relieved in that joint capsule. Limited mobility in the big toe. That's one thing we look at. Nerve-related foot pain, meaning sometimes people's foot pain isn't caused by their foot or ankle. Sometimes it's caused by their back. So that's lower back referred pain, but nerve-related foot pain means things are jacked up in the whole lower leg. The nerves in that region are just irritated. But we'll talk about each of those. So arthritis, easily diagnosed on x-ray if you have a swollen, warm joint that's stiff in the joint, so the thickness of that joint that you haven't seen before, there's a high probability that that's arthritis. You don't usually need an x-ray to see that. It's very common. It can be of rheumatoid or osteoarthritis type. There used to be a wide gulf between, hey, maybe it's a kind of a blood-borne thing, maybe it's a quote-unquote wear and tear thing. There's little less delineation between the two, but regardless, it can be either of those. Pain comes once you move after resting, right? So first thing in the morning, stiffens up. That might be related to some arthritis, particularly in the morning, and it's relieved with moderate activity, but then too much activity, it's not good either. Right?
Can I ask a question?
Yeah, sure.
When you were talking about flat feet, when I was younger, I used to have a really high arch. Now my foot's flat, and I don't know how that over time, contributed to, it's like after having babies and stuff like that, and everything's just kind of, and with age and stuff too, it's just kind of spread out now. So,
that could be a common
On
thing,
arches?
right? And it's not always the foot's fault.
mhm.
Sometimes
Yeah, my arches are flat too.
the hip and lower back. So tendinosis and tendinitis. So tendons are what
They're
muscles.
high.
What's that?
Her arches are high. Mine are flat.
Yeah, and people, like we used to be really hyper focused on arches. Like if you had a flat foot, like we wanted to fix that, like somehow put in a stiffer insole or whatever, or blame everything on that. But people with high arches can have problems too, right? The foot has a certain function to it, right? And let's talk about that real quick. So this is an actual foot model. It's made out of plastic. I'll pass this around. You can play with this a little bit. But one thing that does happen in the foot is there's some flexibleness in this foot. The bottom of the foot should act a little bit like a leaf spring. So when the heel hits the ground and then your foot meets the ground, there should be a little bit of a collapse of that arch as your foot goes over. That builds up a little bit of spring momentum so that springs back up. You with me?
Mhm.
So the heel bone acts as a teeter-totter. There's a tendon that comes from the calf muscle series here, and the bottom of the foot is a strong connective tissue, the tissue that fascia that comes into that heel that tends to form that heel spur. Well, if there's not enough movement here, if that calf muscle is tight, or there's stiffness in that joint, or stiffness in a couple of these bones in the foot, then there's not enough movement here. What one area doesn't do, another one will have to make up for. So oftentimes what can happen, flat-footedness comes about because of lack of muscle control up by the hip, lack of flexibility in the heel foot and the ankle. And then that foot has to overstretch in order to function. So that can be one of the causes, right?
Mhm.
It doesn't make sense that that's strictly an age-related activity because over time, our connective tissue just stiffens. So it's not just an age-related change, it's about how we use our body. Does that make sense?
Mhm.
So tendons are what muscles insert into bones, right? Strong connective tissue, and you can get irritation there, right? That would be called tendinitis, if there's inflammation and irritation. Just because you have pain where a tendon is, doesn't mean that that's tendinitis. Tendinitis would imply an inflammatory process, maybe a bit of swelling, warmth, that sort of thing, right? Oftentimes, that tendon, for some folks, can become just worn. It becomes, the connective tissue becomes disorganized, and that's known as tendinosis. So tendinitis, itis means inflammation, tendinosis means disorder. This might be common for when the tendons feel weak. There could be some swelling around the tendons and muscles. That is going to suggest more tendinitis, an inflammatory process. More movement, it becomes more bothersome. Anti-inflammatory medications may help. Most of the time, the reason it doesn't help long term is because there is a functional problem. There's stiffness in joints, there's weakness, there's lack of mobility, there's lack of muscle control, a number of things, and that's why injections or over-the-counter or prescription medications don't provide lasting relief, is because nothing else changes that might be contributing to that issue, right? We already talked about the risks of even over-the-counter. I'm delighted that people are aware of those risks. Most people who show up at these tend to be a little more biased towards conservative care and are understanding of that. There's other people that are more than happy to pop all kinds of over-the-counters and consult with folks who want to do all sorts of things to them, right?
I think when you've got a lot of pain and stuff, you're looking for relief no matter
Desperate,
what.
yeah.
Absolutely,
Yeah.
for sure, right? So this tendinitis doesn't show on X-ray, CT, or MRI scan. A skillful exam and history will start to reveal that. Flat-footedness, we talked about that a little bit. The more you're on your feet, the more it hurts. Oftentimes pain on that instep of the foot. And certainly people recognize it, right? I mean, they walk on the beach, they can see, yeah, my whole foot's, and then some seems to be making foot imprints. Or after get out of the shower, my goodness, I didn't know my bottom of my foot was so big, right?
Yeah, duck feet.
Right. So, and getting off your feet tends to help those with flat-footedness.
So that's why you have pain on the top of the foot.
Pain in the top of the foot is probably a different thing.
Oh. Or the top of the foot.
Oh, I mean, you can get some pain on the top of the foot. Top of the foot area. Pain in the front of the ankle is likely something different.
Yeah.
So you're right. Simple example of that, and mine was classic for that. In fact, I was diagnosed with peroneal spastic flat foot. I remember to this day, like, it's the first medical description that I read. You know,
Okay.
spastic foot, flat foot, right? I'll tell you a crazy story. So, and I don't mind mentioning his name. Dr. Pilon was an army doc, right? He lived in High Cliff. My family, we grew up in Sherwood, so they attended our same church, and well-respected doc, very like a orthopedist, like loud and proud, you know, like he didn't have lack of confidence, right? So he wanted to do all this stuff. My mom and stepdad were like, yeah, probably not, right? You know, so we're like, we'll figure something else out. So what does my mom do? You know, like every mom, right? They're going to pray hard, and they're going to look for other solutions, right? So I met up with Dr. Pilon a good number of years later when I was about 28. My stepfather needed a knee surgery at the time, and he wanted to consult with Dr. Pilon. They had become friends. They go to the same church, and Dr. Pilon was going to do the surgery, and he came out, I think it was after the surgery, and he was talking to my mother, and he says, yeah, you had a son or something that had really a lot of problems with their ankle and feet. Yeah, how's that going now? And she says, well, he's here right now. So he's like, he thought nothing of it. Well, take off your feet, take off your shoes and socks. I want to see, right?
Of course.
And I did. And he looked at me and he watched me walk. He's obviously a very brilliant guy because he absolutely remembered that case. Because he wrote it up and and presented it in a professional counsel. And he said, this can't be the one that had the problem. And my mother's like, yeah, it was. Well, that stuff doesn't change. How did you do that? Did you have some sort of procedure? I'm like, no, I learned how to strengthen my hips and lower back, learned how to do a number of things, lost some weight, I treated functionally. Like, no, it's not possible for that to change. And I'm like, I don't know what you want me to tell you, dude.
Right,
but,
yeah.
so it's kind of interesting, right? Because his perception was that the only fix could be what he was advocating, right? Which is kind of cool. I mean, it was kind of humorous to me, satisfying, and of course, at that point, I realized that my mother's prayers had been answered, right? So I think that was cool.
Yeah.
So, heel spur, a little bit of controversy here. Like heel spur generally is thought of as pain in the bottom of the heel, right? Take x-rays, there's a little extra bone formation. The only problem is there's many people who take x-rays of their foot who don't have any pain, who have a heel spur present. Mm-hmm. So the correlation between that pain and the heel spur, we don't always know, right? If you get some relief with injection, awesome. And that's
Isn't
fine.
it though usually the plantar fasciitis that's causing that heel spur? The pulling and stuff on the...
There's plantar fasciitis, right? So there's itis, which implies inflammation, but there's a lot of people that don't have any inflammation, right? So the more modern term is plantar heel pain, like pain here, because it can be caused by a number of things. We'll talk about back-related pain in a moment, but there's plenty of folks that I actually started treating as a heel spur, and all of a sudden it's like, gee, this thing isn't getting better. What else is going on? We'll talk about that in a little bit. Heel spurs, though, very common first steps, right? So when during the night, you stiffen up, right? And that's a good thing. Tissue stiffen up a little bit. But when you step and go on your foot, you get a quick, abrupt stretch to that bottom of the foot. Mm-hmm. That quick, abrupt stretch can cause irritation if it is a true heel spur issue or plantar fascial issue. It can tug on that area excessively on first step, right? So some folks, if they do some preparatory work, massage that area, do some stretching, take their time in getting up as opposed to just getting up and stepping on it, they might have a reduction of pain. But that will be in there. But heel spurs, a lot of very young, fit people who are physically active get this. Older folks get it as well.
I was always told that comes from maybe like if you running and exercising, you're not stretching properly and stuff like that in the lower leg and.
It is absolutely, and I don't list this and actually need to change this. Oftentimes it's associated with this. We'll talk about this. We'll talk about this now. So more commonly now, so certainly that calf, If that calf is inflexible,
Right.
that could be part of it, right? But this is the ankle and foot, right? So you got your lower leg here, and this forms an upside down cup. The top of the bone is your talus. That does not have any bony attachment to it. There needs to be enough wiggle room side to side. It's not a big movement, but a little bit of movement side to side during the walking cycle. There also needs to be a little bit of movement of this heel bone underneath that talus. There's got to be a little bit of wiggle and movement there. If that's not there, then more force is going to be transmitted here. So the biggest culprit I see oftentimes is tightness in that calf muscle, limited motion here, and limited motion here.